Mr. Speaker, I rise today to anchor this special order hour on behalf of the Congressional Black Caucus in honor of Black Maternal Health Week. For the 10th year in a row, the Black Mamas Matter Alliance led Black Maternal Health Week last week to address the high rates of preventable maternal mortality among Black women, who are more than 3 times as likely to die from pregnancy-related causes than white women. Black Maternal Health Week focuses on advocacy, community building, and policy change. And this year's theme, Rooted in Justice and Joy, highlights the need for both systemic change to address racial disparities and the celebration of Black motherhood and strength. This special order hour is an opportunity for the Congressional Black Caucus to discuss the ongoing crisis facing our nation's Black mothers and to explore solutions to protecting our community's Black women. So tonight, I start this special order hour with identifying the state of Black maternal health in our nation. In a nutshell, we are in crisis. And the Black maternal health crisis is not just statistics. 11 years ago next week, I nearly became one of those statistics when my daughter and I both nearly died when my placenta ruptured 9 weeks before my due date. I needed an emergency C-section. I had placenta previa, and because I had health insurance and access to pre- and postnatal care, I was one of the lucky ones. But too many Black women in America aren't so lucky. Compared to other high-income countries, the U.S. still has the highest rate of maternal deaths. In 2023, the most recent year for which data is available, the national maternal mortality rate actually declined. But Black women were still more than 3 times as likely as white women to experience a pregnancy-related death, and 87% of these deaths were preventable. In my own state of Virginia, after significant improvements from peak deaths in 2021, Virginia's maternal mortality rate got worse in 2023. Now, we face a complex road ahead as we seek solutions to protect Black women and families against this loss. The maternal health crisis connects health care with insurance policy, reproductive freedom, environmental policy, and so much more. These issues don't exist in a vacuum, and many of them are rooted in decades, I would say centuries, of inequity. These issues require a holistic approach to bring down the mortality rate and save lives. But recent rollbacks at the federal level risk deepening this maternal health crisis. Medicaid cuts and the expiration of the enhanced premium tax credits under the Affordable Care Act have driven up the cost of maternal care for millions, making this vital care inaccessible for those unable to pay for it out of pocket. The Supreme Court's decision overturning Roe v. Wade caused 1 in 3 women of childbearing years to live in states with abortion bans or extreme restrictions. And in those states with bans, women are 2 times more likely to die of pregnancy-related causes. Again, it's not just statistics. We've seen tragic stories of women like Amber Thurman and Candy Miller who died suffering miscarriages, awaiting simple procedures that could have saved their life. But the hospitals weren't sure if they fit within the exceptions to the ban. On top of this, the Trump administration has doubled down on making it harder to secure justice for Black families and address the maternal health crisis in Black communities. President Trump's executive order banning diversity, equity, and inclusion practices, limiting federal government's ability to enforce hospital accountability for treatment of Black mothers, weeks after the Biden administration reached a historic settlement agreement to uphold these guidelines and provide training for hospital staff to address bias. Under the Trump administration, funding cuts and mass layoffs have left agencies like the Health and Human Services Department without the resources or staff needed to conduct research and implement policies that save lives, and thousands of data sets that have helped identify the maternal mortality factors and track how we're doing with policies to address them. These data sets can no longer be assessed. Now President Trump wants to go even further, as his proposed budget for 2027 calls for over $800 million in cuts to maternal and child health programs at HHS. The proposal would eliminate many essential programs entirely, including the Healthy Start program, which serves mothers and infants in high-risk communities, the maternal mortality review committees, the perinatal quality collaboratives, and other programs that track maternal mortality and share solutions for reducing it. This is not acceptable, and the Congressional Black Caucus will do everything within our power to oppose this proposed budget. But in the face of these setbacks at the federal level, we will continue to push for change. As a member of not only the Congressional Black Caucus, but the Black Maternal Health Caucus, and especially as a mom who faced that crisis personally, I am fighting back as we continue to push forward, because we cannot afford to wait, and we certainly can't afford to sit back and do nothing. And that's why I'm co-sponsoring the Momnibus, a package of 14 bills that aims to address the root causes of maternal health challenges, provide support to mothers, and study how we can build a better system for every American family in need of care. The Black Maternal Health Caucus has fought for this legislation for years. We will not stop until it becomes law. It must become law now. Our fight remains far from over, but legislators and advocates alike continue to work towards tangible change to eradicate this Black maternal health crisis. And I am proud to stand and work alongside members like the chair of the Congressional Black Caucus, who I yield to now, Representative Yvette Clarke from New York.